Joining us now via Skype is Ballad Health's Chief Infection Prevention Officer, Jamie Swift. Jamie, these numbers looking really good. I mean, trending downward. We had I counted about 44, 45 new cases from the Department of Health for all of Northeast Tennessee and Southwest Virginia today. What's your read on the current numbers?
We're continuing to see a good trend. The numbers are down, hospitalizations are down, and so our goal is to just keep us going in that right direction.
And I suspect you have some specific ideas about how you want that to happen. What would that be?
Certainly, as we've opened up in Tennessee and Virginia to 1C, that makes vaccine eligible to a lot of people. And so I really encourage people to look over the guidelines for 1C. It may be more than people realize. Get vaccine, keep wearing your mask, social distancing as much as possible. I know there's some guidelines out there today from CDC about vaccinated people taking their mask off. I encourage you to go read the actual, not just the headline, but the entire post, because it's very specific about when they recommend it and when they don't for fully vaccinated individuals.
So let's go there. Right now, I know the CDC is saying as of today, if you have been fully vaccinated and you go 2 weeks out, that you have some freedom now to come into one-on-one environments without a mask on with others who are the same. Is there something that you feel is super important that people really also understand about that?
I think it's really important, like I said, to go to the CDC website, click into the further link about the official interim recommendations. Read those. It gives you the specific scenarios. Like you said, if you're fully vaccinated, you're with someone else who's fully vaccinated in a single home, and you can unmask and without really any risk. A couple of things, it doesn't apply to large setting. It doesn't apply to healthcare, so we don't expect any changes in our facilities. So you've really got to understand it's talking about those small gatherings, house to house, family to family, not much beyond that yet.
Okay, let's go back to the 1C designation, which started today in Tennessee. That's 16 and older with a lot of medical conditions that are very common for a lot of people. We're talking diabetes. Also, their caregivers can now get vaccinated. And we understand at the Niswonger Children's Hospital, there's a vaccination event for teens, specific category. Who is that for, and what do they need to do to sign up for that?
So we're very excited for Niswonger Children's to offer this. It's really a vaccine pod that we've been having designated for 16 and 17-year-olds. We know sometimes they may not want to go to a pod with very different age crowds, more of a crowd. So what we've done is bring in some staff. We're going to run a vaccine pod for 16 and 17-year-olds who qualify. So it's those same medical conditions that are listed in that 1C. So go look. If you're 16 or 17 years old, qualify in that. We're going to have a vaccine event Tuesday, tomorrow, and Thursday. So Tuesday and Thursday of this week from 4 to 7 p.m. at Niswonger Children's. It's walk-in. You don't have to make an appointment. We don't expect there to be a huge demand. We'll be monitoring the crowd and keeping people socially distanced and safe. A parent does have to come with them. So a parent still has to come sign all those forms for us, and then we'll get them vaccinated.
And those for teens with high-risk conditions specifically?
It is. Okay. It is. Any of those conditions are in 1C. If your 16 and 17-year-old falls into 1C, then they can come into Niswonger Tuesday or Thursday of this week and get their vaccine.
Jamie, I think there are a lot of people who are in this 1C who are hypertensive. They have high blood pressure, or maybe they have type 2 diabetes, but they're doing a great job managing it. And maybe they're thinking, I can't get vaccinated now. There's got to be somebody who needs it more than me, even though technically I'm eligible. What would you say to that person right now?
When we first started this, the issue was vaccine supply. And so both states were very strict on who could get it, keeping it to that 1A1, honestly, and really having to balance what do we have versus who we can give it to. Supply really isn't the issue at this point. There's good supply in our region. There's several access points. So the health departments, Ballad Health, many local pharmacies, physicians' offices are starting to get it. So there's lots of vaccine available. So I encourage people, I hear it a lot too. They think I'm not sick enough to be into 1C and go get that. If you've got a chronic health condition, go look at that list. And if you qualify, come get it. Now is your time. If we were concerned about supply, if the state was concerned about supply and not having enough, they could have opened up in phases. They've opened it up to all of 1C, so I really encourage people to make that appointment.
Less than a minute left with you. I want to ask you this final question. We are seeing a positivity rate according to the health department. I know ballot numbers are a bit different, but the positivity rate for health departments for most counties is around 5%. That's been the target you were hoping to get us to. What does that mean now as we move forward, do you think?
If we can maintain 5% across individual counties, we do have some counties that are still a little higher than 5% and actually kind of starting to go back up a little bit. So we're keeping our eye on those. It gets to that point of you've got at least somewhat of a controlled spread. I mean, you still, it's not zero, it's not the 1%, which is completely contained, but 5, it just means your chances in a large group much less likely to be exposed to COVID. So if we can get there, stay there, get vaccine out, and maintain that 5%, things are going to start looking a little different around here.
And not a moment too soon for that. Jamie Swift, I know you agree with that at Ballot Health. Thanks so much for your time as always. We appreciate your expertise.
Thank you.